This is a demonstration of Patient Journey, a patient-physician interaction based on a framework recently developed by iLink Systems and St. Joseph's Hospital using Microsoft's Surface touchscreen computer and Microsoft's Health Vault and Amalga medical records management solutions. Our demonstration starts with a patient and her physician sitting down at the touchscreen together. The patient logs on first by tapping the screen with her ID card, then entering her private PIN number. This automatically logs into her personal health records account. Her physician then logs into the hospital's medical records repository, which pulls in data from multiple systems within the hospital. Simply by clicking the microphone icon, any or all of a series of interactions between a patient and their physician can be recorded using an attached microphone. Recorded conversations can be saved, browsed, and played back later. They can also be shared with the patient or with friends and family members supporting the patient. Here's how they'll access the information that comes from the patient's personal health record. And here's how they'll access the information pulled from the hospital's multiple line of business applications. The scenario we present here is a series of doctor's appointments between a patient who has been diagnosed with breast cancer and her doctor. They review medical records, discuss the treatment plan, including surgery, and talk about coping with life as a breast cancer survivor. Now the physician pulls up a health history form to discuss the patient's family history. Everything that the physician is able to pull from the hospital side of systems can be transferred to the patient's personal health record account, which the physician does now. Next, they look at genetics. Notice the different navigation options that they can choose from, depending on their personal preference. There are different ways they can scroll through the different documents. Now they pull up a genogram. At this point, we see another useful feature which allows them to toggle the navigation icons on and off. With a touch, the navigation icons disappear, improving the view for both physician and patient. Documents can be rotated for easy viewing by the physician, the patient, or perhaps by family members sitting across the table. And they share the genogram with the patient's personal health records account. Now they look at diagnosis information. They pull up an image of the breast tumor. This is the patient's mammogram. Like all of the documents they review in this scenario, they have the ability to record voice and written notes and attach them to any of the records they examine, which can be played back or read later. And they share this with the patient's Health Vault account. So far, they've examined information from health records, genetics, diagnosis, and multimedia files, which of course could take place during a series of appointments. Now they move on to treatment. Here are some of the documents that are available from the hospital's systems concerning the patient's treatment. The physician pulls up a treatment summary form. This provides an overview of all the treatment provided to the patient. And here, one thing to notice is that the documents pulled from the hospital side of the system have a red tab across the top. And any documents pulled from the patient side have a blue tab across the top, just to keep things in perspective. One additional discussion and review tool is a 3D image of the human anatomy that gives the patient a better idea of her condition. There are different navigation options and different anatomical images to choose from. Here the doctor has brought up a 3D image of the human anatomy that in this case will show the female torso. In this scenario, the physician's objective is to discuss how surgery is going to be performed to remove a breast tumor. As you can see, the image can be zoomed in and out, and it can be rotated through 360 degrees. There are a number of navigation and markup options, as well as a number of different anatomical views available to illustrate almost any medical condition. The physician marks where the tumor is located. The physician can also show approximately where an incision will be made to remove the tumor. Again, using the markup options, a marker flag can be placed to highlight and annotate any part of the body with audio or written notes. Once again, each consultation between a physician and patient can be recorded in its entirety and saved for playback. That concludes the demonstration. As you can see, being able to view and share all of these records from different locations and formats together using simple hand gestures helps the physician and the patient cover a lot of ground in a very short time. The technology iLink used includes 4 Microsoft solutions: Surface, Health Vault, Amelga, and WPF. Surface is the touchscreen table computer. Health Vault is an online service which allows anyone to securely store and transfer their own medical records. Amelga allows hospitals to assemble medical records from all of their departmental systems, and WPF allowed iLink to create the cool 3D graphics. Thanks for watching.
Some of the main benefits of this application are the seamless movement of information between clinical systems, as well as the ability to access information from different line of business applications using Microsoft's Amelga, as well as for the patient to pull in their information from Health Vault at the point of care. Also, the ability to showcase the educational component where a physician pulls up a 3D image of a human anatomy to showcase where the tumor is present, how the incision is going to be performed, as well as markers that explain a little bit more about the area of incision, etc. Understanding their conditions better, help them manage their health in an improved fashion, as well as the ability to share that information with their families.
The Patient Navigator application is built to implement the workflows that are part of a cancer hospital. Doctor and the patient's dialogue between different visits during the course of cancer treatment are captured in this, and that is used as the framework for the functional workflows that are in this application. Surface SDK, being an extension of WPF, helped us tremendously in reducing the time it took for us to develop this application. We have used a 3D visualization and then the application around discussing the treatment procedure on a 3D model. All this has been built completely in WPF using XAML. We believe patient having the ability to share information and then having the ability to choose what information from the Health Vault account can be shared with the doctor during the visit is very useful. And the doctor having the ability to identify exactly what patient records are relevant for that discussion and then orchestrate it beforehand and then use those during the meeting with the patient. That part is as well a very useful component of this application. Overall, we are very excited about the application and what it can do to patient and doctor interaction in a cancer hospital. And we are very excited about the Surface platform itself and the ability that it provides us to build this kind of applications.